Welcome to our informational meeting that we've got here today to learn a little bit more about 40 Square and another opportunity for you farmers that may be listening to this or watching this webinar that offers you something different compared to the traditional plans that you see out on the market with maybe Blue Cross or Medica. I am Suzanne Dickson from Americana Insurance that many of you may know. I also have with me today is Mike Oothoudt. Mike is somebody who I lean on when I work with groups and other plans like this where I'm out of the individual market. So Mike is going to be working with me on this webinar today, and I'm going to let him take over from here.
Thanks, Suzanne. Well, let's jump right into it here. So really the purpose and mission of 40 Square, which has been a long work in progress. There's been a group of co-ops that have been trying to put together a health program like this for around the past 15 years or so. But the mission really is, of the co-op, is to bring quality, sustainable healthcare coverage to Minnesota's ag community. And they're doing this through a self-funded health plan that's controlled by the co-op members, which would be you if you join the co-op and the plan. So you'll have control of this self-funded health plan. The co-op was formed as a 308B co-op in 2009, and just with the recent legislative changes that happened last December when Governor Dayton signed into effect the 25% premium discount in the individual market, they also made some changes to Minnesota law that now allowed a co-op like this to actually come into existence. So the co-op is really about trust, transparency, and ownership. So as an ag producer, you have the opportunity to be part of and have ownership of the co-op. So just to start out, when you buy into the co-op, you're buying $100 of voting stock, and you would also, as an ag producer, buy $1,000 of the Class A voting common stock. So these are both one-time costs to buy into and be a member or owner of the co-op. They do, because it is a 308B co-op, they do have additional shares of classes. So there are Class B and Class C shares, which Class B are voting investor stock shares, and Class C are non-voting investor stock shares. The structure of the 40 Square co-op, because this is a self-insured plan, you actually have a plan sponsor, which is the 40 Square Cooperative Solutions. They are the plan sponsor. And it's funded through a joint self-insured health plan, which is actually a trust. So if you think about the consortium, this is what's called a MIWA, or a multiple employer welfare arrangement. So the multiple employers involved in this are you, the ag producers. The co-op has a board of directors that's made up of producer members, investor members, and also advisory members, of which we'll get into. Like one of the advisory members is EBSO. They are a co-op partner helping with some functions of the co-op, and we'll get into that a little bit later. There's also called the consortium, which is separate from the co-op and governed by a separate board of directors, and you can see who the steering committee members are today. And the important piece of this is that the participants have 100% ownership of the trust, and that's very unique to 40 Square and how this is co-op set up for the co-op and their members.
Next, we're going to talk about becoming a member of the 40 Square. And according to law, to be a member, you must be an employer a farmer who actively works in production agricultural in Minnesota, you must either file a Form 1065 or a Schedule F with your income tax return. You must purchase that $100 voting stock. You must also purchase the common stock of $1,000 over the first year. They also are going to require you to give them a 3-year consecutive commitment. So you must remain in there for 3 years. The other thing is you need to have one common law employee. And I guess what is a common law employee? 40 Squared eligibility requires the employer farmer to prove he has had an employee. So you hire somebody to mow your lawn using your equipment. You hire your help in the harvest and pay them a wage, or you hire them in the spring to help with planting. Your spouse is hired to do bookkeeping and paid a wage. In all of these cases, a W-2 must be provided to the employee, so which is very common for quite a few farmers today. So the other thing is just check with your accountant or your attorney to make sure you're qualifying here.
So let's jump into the actual plan itself. So we talked about this being a self-funded health plan. And here's really how a self-funded health plan works, is that the health plan itself is assuming the financial risk of the claims or the health plan. A trust is established and funded by premiums, and your premiums go into this trust to be only used for the health plan and then used to pay out claims inside of that health plan to its members. Now, because most health plans don't want to assume unlimited financial risk, they go out and buy what's called stop loss or reinsurance. This is really done to limit the risk and to protect the health plan. So up to a certain amount, the health plan will be liable for any claims going on inside of the plan. Anything over and above the amount they buy reinsurance for, then the reinsurance carrier is responsible for claims over and above that. That's really important because you want to be comfortable with, well, if one member of our plan has a big, really large claim, is it going to blow up the plan? And no, it's not, because we're buying stop loss reinsurance here. So they buy reinsurance both at the individual and the aggregate level. So both at the individual member and the plan as a whole. That's what those two things mean. There is an actuarial review every month for reserves to ensure there's proper reserves there to pay the claims. And then another important piece of how the co-op got up and started is they did receive some substantial federal grants to help really get this thing off the ground and ensure that there's money there on day one to pay the claims. There is what's called a third-party administrator involved. So it's managed by a third-party administrator. They will be the ones who actually, the claims from the healthcare providers are sent to this TPA, and they process the claims, they pay the claims, they send you your explanation of benefits. They're the ones keeping track of everything behind the scenes inside of the plan. A self-funded plan gives you a much greater level of flexibility. We'll go into some of the details of additional services and tools that have been built into the plan. And going forward, you'll see that because it's self-funded, the members own the plan, you really get to, along with your board of directors, tailor the plans to suit the needs of the population of the members. So you really get to design the plans along with your board of directors. It is governed by ERISA, so it's a compliant plan. Some of the partners that are involved, Cigna, that is the network of providers that you can utilize as an in-network provider. EBSO is your third-party administrator processing those claims. MedTrax RX, that's your prescription drug formulary and provider network. Healthiest You, that's going to be an or a electronic doctor on demand service where you can go and see a doctor right through your smartphone from the comfort of your own home. And then lastly, we have a healthcare concierge service that will really help with a lot of things or questions that you have as a member. They're able to step in and really hold your hand through some of these difficult things that make life easier for you. And we'll go through what many of those are in a minute.
Next, you will see that there are a wide variety of plans available. Two that are a lower deductible that have some copays, and then there are 4 that have a medium to a higher deductible that are an HSA compatible plan as well. Still offering a lot of the routine care as you see in the traditional market, as well as, like I said, some lower deductible ones with more copays on primary care and urgent care and prescription drugs to more of the higher deductible HSA compliant plans.
All of these plans are ACA compliant, and they work just like the plans that you're used to today. They have deductibles, they have out-of-pocket maximums. It is real health insurance, and you're able to check that box on your tax forms that says, yes, I do have health insurance. There are no lifetime limits, no pre-existing conditions. Routine preventive care is paid at 100%. Doctor's office visits, prescription drugs, those are all either subject to a deductible or a copay. There is hospital care, inpatient and outpatient, as well as emergency room. As we talked about before, the Healthiest You is your telemedicine aspect of this. And then you have the patient advocacy or concierge service that we're going to get into here. So really, Healthiest You, so your telemedicine, is there to find a way for members to access care when they need it in an easier method at a lower cost than you're traditionally used to getting care for. And they're doing this because studies have been done, and the studies say that over 70% of all of these visits could be handled through the telemedicine aspect or route of service, which actually costs a whole lot less than going in to see a doctor at the emergency room or just a normal office visit even. Here we're going to walk through some of the reasons. We won't read them off, you can see them, but these are many of the common types of reasons that we go to the emergency room for visits that can potentially be addressed through the Healthiest You telemedicine aspect. So what is Healthiest You? They are real licensed doctors. They're all board certified licensed physicians. They can diagnose, treat, and prescribe medicine. There's 24/7 access available in 49 states, and there is no cost to you as a member when you are using this Healthiest You visit. So really great in terms of if you are going into either a primary care, urgent care, or emergency room, you're going to pay some sort of dollar amount when you're going in for these types of visits. The average primary care visit is about $125, average urgent care visit about $175, average emergency room visit about $1,200. So you can imagine if you're paying nothing, taking care of what you need to get done, having your medicine distributed right to the pharmacy, you can go pick it up and there's no cost to that visit versus $125, $175, $500, or $1,200, whatever it might be. That's saving not just you, but the plan money as well, which helps you in the long run as a plan member by saving money up front, but also having lower claims in your plan, which means lower premiums down the road. On to the concierge service. So there's a lot of different things the concierge service can help you with that you can call them up, get help with, whether it's understanding your healthcare coverage offered by the plan, understanding how a claim was billed or paid, finding out what type of services are am I going to go in for? Maybe I have an upcoming visit. I need to get pre-certified or pre-authorized. They can help you do all of these things. They can help you find in-network providers, understand your tests and treatments. If you ever did have a balanced billing situation, they can help with those types of issues as well. There's somebody to lean on when you have questions about what's going on inside of your plan. So let's talk now about how do you go out and get a quote, or how does your plan actually price? So this plan's a little different than what you're used to in that some of the things are the same, some of the things are a little bit different. Your price, each person in the plan is priced based upon these things: the zip code of where you live, your age, and your plan choice. Those are all things that you're used to today. The one thing that you're not used to is your price will be based upon your medical background as well. So when you go through the process of actually getting some pricing, you're going to answer a list of health history questions that will in turn determine what type of pricing that you receive as an individual. All of these plans, they do have a guaranteed offer, so you will receive a premium offer, which will be based upon those 4 things above. One important thing to note here is that all premiums will be paid by the employer through an automatic withdrawal, so an ACH.
Now we're going to talk about what's next, open enrollment dates, what you can expect, how you find out info. On the screen here, we've got the website where you can go to www.40square.coop. That started November 1st. They've got a great website set up that has asking questions and what are some different things to know about the plan, and you can use my info on there as an agent, so Suzanne Dickson, and I've got my agent number listed there, 261 IFC. It'll ask for a broker number. You can also call me. We'll get to that towards the end. I'll have all my contact info, and we can talk about options if this is going to work for you or not. The open enrollment does run like the open enrollment does in the traditional market, where right now it's November 1st through December 15th for a January 1st effective date. So that is a lot like the traditional market.
So this is what you're going to see when you go out to www.40square.coop. This is the landing page. On the very first page, you can sign up to learn more, and basically what that's going to do for you is anytime there's updates about the co-op, they're going to notify you as well. If you scroll down on this very first page, you're going to see where you can view the doctor network. So it's the Cigna network, but you can go in, you can follow the instructions when you check the doctor network. Just follow along, put in your location, and they'll walk you through which network to select. And then you can make sure that your doctors that you want to use, the facilities that you want to go to, are all included in this plan. So when you go out and register, they're going to ask for some pretty generic information. They're going to ask for your zip code, and you're going to start by registering at the employer level. So this is going to be the farmer going out and registering. Like Suzanne said, if you want to do it on your own, you certainly can, but you can call up Suzanne. She'll help you through the process. They're going to ask for your zip code, who you want to cover, dates of birth, etc. Then before we get to this pricing, that's where you're going to answer the health history questions on each individual. Once you get through that health history portion, this is what's going to come up: the 6 different plans that are available and the pricing per person. You're going to be able to view that right on the website. Here's another screen that shows it in a little more detail. If there was more members, they'd all be listed out individually, but it's going to show you again what the plan is, total cost for the family, as well as by per person. And here's where Suzanne is really going to help you figure out which type of plan is the right fit for my family if these premiums look attractive versus what you have access to elsewhere. If you have any questions, you obviously can call Suzanne and get more information, sit down and walk through the information, get a quote, look at the pricing.
Yeah, I just want to thank everybody for taking the time to watch the webinar. Hopefully we gave you just a kind of an overview about what 40 Square is, since it's kind of come up towards the end of the year here, and we are getting a lot of things pushed at us and trying to figure out what's most cost effective. You can contact me here at Americana Insurance here in Albert Lea. My phone number is there, 507-377-2000. You can also email me. I've got my email listed there. Again, I just want to thank you for taking the time to watch this, and hopefully we can figure out something that works good for you. And I want to thank Mike for helping me lead this webinar.
Thanks, Suzanne. The last thing we're going to give you access to is, here is 40 Square's contact information. Feel free in the meantime, prior to having questions directly to Suzanne, you can go out to the website, look around. They can answer some questions as well. So we wanted to provide that information here. Thank you everybody for attending, for listening to the webinar, and contact Suzanne should you have any questions or want to look at this as one of your options that might be a great fit for your family. Thank you.